We will get to today's topic, when interprofessional education is a disaster. And I'm very happy to introduce you to two amazing faculty members, Dr. Angela Clendenin, who is from our School of Public Health at Texas A&M, and Martin Mufich, who is with our Office of Interprofessional Education and Research and also a faculty member in our College of Nursing. And Dr. Clendenin is going to go ahead and share her screen now so that she can walk you through the topic for today.
Okay, so on behalf of Martin and myself, I'd like to say thank you for joining us today. This is a project that Martin and I have been involved with for a while, and we're pretty passionate about it, so we hope to have a really great discussion at the end. By the time we've completed our session here today, we hope that you'll be able to identify several components of an interprofessional disaster simulation, that you'll be able to articulate ways that you can integrate the IPEC core competencies into a disaster simulation across disciplines, and to understand some of the key challenges that we've had to deal with and continue to face moving forward and being successful. So you may have heard about Disaster Day, but if you haven't, Disaster Day is the largest student-led interprofessional emergency response simulation in the nation. And we're going to be able to define it a little better for you in the coming slides, as well as give you some pretty interesting numbers to see how we've been accomplishing what we do. So Martin, why don't you share a little bit about the history of our program?
Thank you, Angela. Hopefully everybody can hear me. And also I want to thank Glenn Barnes. We're partners in crime when it comes to disaster education for the students in the state of Texas. So thank you, Dr. Barnes. So how did Disaster Day start? Well, it started with mostly out of the College of Nursing in the wake of Hurricane Ike back in 2008. A lot of the victims of that hurricane came up to the College Station area and were actually housed in shelters as big as like the Reed Arena basketball and also the vet school, right? So it was decided that we needed to try to train our students, because our students were pulled in to help. And when I say students, it was mostly College of Nursing students back then, but we did have other students helping out. So we're trying to get proactive about training these students. It was a hospital surge exercise. It was in a big church gymnasium when we did have these disaster days for I think about 9 or 10 years. There were students from, the College of Medicine and Pharmacy, School of Public Health, Vet Med, but kind of the focus of it on those early years was through the College of Nursing. The IPE office, IPER office came in, and it was decided that they would kind of take the reins of Disaster Day, thankfully, and make it more IPE, make it an IPE event. So in 2018, it came under their management. It kind of moved away from a disaster simulation focused on clinical competencies, and we'll probably talk about that a little bit later today, or on this session, and more towards interprofessional competencies. We were lucky enough to partner with the Texas Engineering Extension Service, TEEX, which has Disaster City, which none of you, if any of you know about it, it's a great training facility, about 52 acres of rubble and buildings and collapsed trains and all that stuff. It's one of the best training places in the world. And they also are the experts, right? So that started in 2018, more of a very IPE-centric model. It went from the student planning committees to the steering committees. There was faculty involvement from every discipline that wanted to participate. In 2019, we brought in May's College of Business for management expertise, because there's a lot that goes on with these things. Also in 2019, added the Corps of Cadets and state emergency responders. Recently, back in February in 2020, we included a psychology and graduate medical students. So right now, we have a lot of partners. You know, we have the medicine, nursing, pharmacy, public health, veterinary, psychology, veterinary medicine, psychology. Most recently, the head of Texas Department of Emergency Management became a vice chancellor for disaster and emergency services under the Texas A&M system. He is now one of our partners, as is TAMU. The Texas Department of State Health Services provides their expertise and knowledge, as well as the Southwest Texas Regional Advisory Council. A great partner that we have now is the Texas State Guard, which is standing up I believe it's a platoon or a company here in town. So they're there to help us. The good folks at TEACS and Disaster City, as we mentioned before, the Corps Cadets, Texas A&M Telebehavioral Health, the Mays Business School, and sponsors, great sponsors like HEB that provides the food and much more, and a Greco.
So we talked about some of the numbers and why we know it's probably one of the largest in the nation. Martin was sharing with you all of the colleges that were represented in the planning and the executing of Disaster Day. We have 6 of the colleges within the Texas A&M University proper. It takes about 20 members of the faculty and staff to serve on a steering committee that kind of guides the process and advises the process moving forward. And who we're supervising is about 60 students who make up the student planning committee, and they come from all of the different colleges that are participating, and they have a number of committees that we can talk about in a little bit. But we try to make sure that out of all that student planning group, every discipline's represented as much as possible on each of the planning committees. They put in about 10,000 hours of planning. So we ended Disaster Day 2020 on February 14th, and within the next 2 to 3 weeks, we already had our date for 2021. We were beginning to, refine our process to start recruiting leadership and student planners for this coming year. So it is a year-round planning effort. We know we need to measure and assess if we're accomplishing the objectives of Disaster Day. And so we have 50 members of faculty and staff from the participating colleges serve as evaluators, and they go through training. They kind of walk around the rooms and the field hospital in the different areas and make observations about the types of activities that are going on and making sure that we can correlate those to achieving our objectives. At the end of the day, we have over 700 students participating, either as providers or as patients, as administrators. So we have 2 sessions, one in the morning and one in the afternoon, and Disaster City becomes a very well-populated community during this exercise.
So learning objectives, as I mentioned before, initially it was very clinical driven. We'd have faculty from the different disciplines seeing how their students would react in this environment, in this simulation. It was moved over to more of an IPE centric model of evaluation and learning. And those of you who are, hearing the introductions during at the very start of this session, there's a lot of IPE folks out there already. So you're aware of these IPEX core competencies that we want to see integrated. And for many times here at A&M anyway, for us at the Health Science Center, this is the first time these students are really kind of getting a grasp of this IPE model. We do have an IPER conference in the fall, but in the spring for those new students, it's kind of the first time they see these. So just to kind of review that, these things are like values and ethics. You find value in what your team members are saying, mutual respect, and learning from them. Roles, responsibilities. Okay, I am a medical student. This is my role. These are my responsibilities, and finding out exactly what those students are learning and what those students will learn to do. We are finally kind of moving away from this idea of learning in silos. And so this is a great thing, you know, at an academic level to find out what other disciplines are doing, because you start talking, you start working together. When you're out in the workplace, it just becomes better. Interprofessional education, learning how to work together, communicating with patients and families and communities. This is just a team approach, As many of you know, studies show that people that have some background in interprofessional education and work as a team, the patient outcomes are better. And then the teams and the teamwork, how it works, and learning that kind of give and take that you're going to see in a real setting.
So one of the things as we were building our undergraduate public health program that we learned about the market for students going out to find jobs, and it actually really applies whether they're medical students, pharmacy students, nursing students, public health students. The professionals out in the working world would really like to see students have some exposure to emergency management concepts before they get out into the workplace. It kind of would set those candidates above all the others. So we do implement a structure that is very much like an incident command structure. We follow ICS on the day of the event. But as you can see here, this is our organizational chart. It does fluctuate from year to year based on the needs and who we can bring in to volunteer. But you see that we have the component advisors, one from each of the colleges as a steering committee. And then there are faculty advisors for 4 different areas. Under those, we have co-commanders, co-incident commanders, and we've had some really exceptional students in the past couple of years serve as those student leaders, and they are the ones who keep everybody on track. And as you can see across the bottom row, those represent the committees that we have set up, whether it's developing cases or training for participants, inventorying and acquiring supplies, making sure that the budget is spent correctly, general administrative tasks, PR, media, moulage. So there's a wide variety of tasks that have to be performed. And so by using this structure, it builds in accountability as well as organization to our participation.
So process and preparation, kind of going back to that former slide, what Angela said is very dynamic. These org charts have changed 3, 4, 5 times over the years because of the fluctuations of how we're trying to organize, like she said, the numbers of students involved. So many, as you saw down there, a lot of different committees, a lot of things to think about. So part of this is case development. How many cases do we have? So, you know, we might have 100 different cases plus in a database. Many of these cases, in general, are kind of the same thing. Maybe it's a broken leg, but there's always possibly how the scenario-specific broken leg plays into part of that. PR media, back in the early days of it, you know, you would get a little bit of PR or a little bit of media from the local TV station and maybe a newspaper, but now it's really kind of blown up into quite a bit of press. A lot of VIPs come out with our partners. There's a lot of upper level administration, university administration that kind of comes out. Logistics, you can imagine logistics can be a very big challenge, especially at a great training facility like Disaster City. It's somewhat not remote, but it's not on the university grounds. It's down by the airport, and so we have to bus students in and out because of parking restrictions. So the run of show, how it works, the timing of it all, is something that's quite a bit of a challenge. Angela spoke to supplies and moulage. How do we get supplies? Can we get donated supplies? Moulage, they have some great moulage makeup people at Disaster City, and so we always try to get their expertise to help us day of, because that makes things very realistic. And then, like Angela said, evaluation. How do we know we're successful?
So Martin and I both over the years have noticed that, there's a lot of challenges that you have to face when you're trying to build something as large and as successful as this type of training program. And one of the big challenges is time and scheduling. When you're trying to bring together, 10 to 20 faculty members and 60 student planning committee members, finding a room and a time and a day of the week that everybody can come together for that meeting is a significant challenge. Beginning, we may only meet once a month or every 2 weeks, but when it gets close, we start meeting every week. And so that's a huge challenge. And plus, we have to build into that some of the pre-event training, safety training and incident command training that participants have to have before the day of. So I think you're kind of getting the picture that this is a large-scale event with a lot of moving parts that requires a tremendous number of people, a tremendous effort to keep it moving in the right direction. Martin, what would you add?
So before I forget, I would be remiss, there's a lot of different ways to do IPE with our students or, out in the community. But the thing that is much of a challenge is that this is not only IPE, where a lot of times these students have never really worked with students from another discipline, but it's IPE in a disaster simulation. And so many of these students, the majority for sure, have never been in that type of environment. Put on top of this is to actually have them at a site to where the moulage and the patients and the broken limbs and the screaming and the overturned cars is very realistic. So there's a lot of challenges from that viewpoint, okay? The demanding workload, Angela spoke to this, demanding workload for members of the Student Planning Committee and Faculty Staff Steering Committee. This is a huge undertaking. It has helped students secure employment when they talk about the roles that they've done for Disaster Day. But one thing that we have to remember is that these are students. They're there to get a degree and learn what to do when they get out. So we have to be very wary of the amount of work we place upon them because once again, they're students. They've got tests. They've got finals. It's much of a challenge. So the majority of Student Planning Committee are new to the event and disaster management in general here at the Health Science Center at Texas A&M. The most a College of Nursing student would maybe go through 2 disaster day simulations. The first one, they might just be a patient, and they might just be a person on a cot. And then maybe the next year that they would either be a provider or be part of the student planning team. Medicine, they may only be there for 1 year. So with students, a student turnover, the planning and actually the simulation participation is kind of reinventing the wheel almost every year because you have so many new students that have never been exposed to this. Meeting the expectations of multiple stakeholders is always a challenge because, people want to kind of come out and, you have, hey, we're doing this for you. Can you do this for us? Trying to weigh all those requests, and at the end of the day, to be true to your mission of teaching these students interprofessional education and also disaster, how to help in a disaster. And then lastly, the other concern is, there's other disciplines and organizations because it's a great event. It gets a lot of press and they want to kind of come out and they want to participate. Hey, can I bring XYZ out on the day and we can do this? Well, we're hampered by a couple things. One of them is that we can only have so many people at the training facility because of weather concerns. But the other one is that we're not quite sure what we can do. And you can imagine that the timing it's challenging enough to get everything done that we think we need to. And so many times we have to respectfully say, well, not this year, but please reach out to us and let's discuss what you would like to do in the next year.
So we've learned a lot over the years, as you can see, as it's expanded and grown. There's a difference between student-led and student-planned. And because of the nature of disaster city and the inherent risk that you face when you're working in a disaster zone, even though it's simulated, there has to be a lot of oversight by the faculty and the staff. But our students go above and beyond. Yes, they plan the event, but they are also student leaders. Some disciplines grant clinical hours for participation and some do not. It's one thing, you know, if you have students that are taking classes on main campus and not just in their discipline, those other professors are not obligated to let them out of class. If you have a student that's taking all classes within a discipline, it's a little easier to get that buy-in. And our students often have some pretty unrealistic expectations about what this is going to be like and what they're going to be doing. And so we have to make sure that we're steering the ship in the right way. Martin, what else have we learned?
So kind of the next bullet point, the scheduling and the agendas kind of goes to those expectation parts. How can we get the most bang for our buck? How can we, you know, hopefully have everybody have a good outcome and have a good experience with this? Trying to get the different disciplines to find a day when this works for everybody is always kind of a challenge. And now we finally found, over the years, we found a pretty good time frame where that works. Kind of going back to that unrealistic expectations type thing. Students don't know what students don't know, and so they think, well, I can do this, and they'll strongly advocate to do this, but we have to kind of push back and say, no, this is not what really happens. And we are so fortunate to have these great partners, these professionals working with us to ask them. They're the sounding board. Hey, how does it really work? This is how it's really done. And so we can tell that to the students. And then finding true interprofessional communication and engagement is the challenge, because, you know, we spoke to it before. You know, these students are coming out to this training facility that is incredible. They're having to make decisions that they've never had to make before on the fly. And then they got to try to be interprofessional at the same time. So it's quite a few things they've got working.
Exactly. And I'll just add on to that real quickly. You know, when the pressure's on and you're faced with a time crunch and an urgent situation, I think it's everybody's innate nature to retreat to their comfort zones. But that's not where growth happens. Growth happens when you're uncomfortable. And so we make it very clear from the beginning as faculty that we're not there to make sure they're comfortable. We're there to make sure they're uncomfortable so that they feel the pressure and they grow. But it is in a low consequence environment, so they should feel more freedom to step out of their comfort zone. But as Martin and I were putting this together, one of the things that we were wanting to share with y'all and to get a discussion going is, are any of y'all involved or developing or implementing an event like this? Have y'all participated in one before? So this can be answered by anybody. We're just kind of throwing it out there to y'all.
This is Dr. Miranda from the dental school in Dallas. And my comment is, I've been trained as a forensic dentist to, you know, as to if there was a disaster, how to help with identifying people, how to age estimation. So that has been my involvement so far. And as the forensic dentist for here in the Fort Worth County, that's how I participate in anything that involves any kind of disaster at a county level or at a larger level.
Wow, that's it. That is really interesting. I don't think I've ever met anybody that's done the forensic dentistry before, but you see it in all the crime shows. So anybody else?
This is Dr. Glenn Barnes. I spent a little bit of time with the military, and one of my duties there is I was the officer in charge of a Joint Task Force North mission where we train federal law enforcement in disaster management, emergency management post 9/11. And that was, we actually developed quite a few protocols after 9/11 for federal law enforcement.
Oh, very cool. I see from Debbie, they have a 300 plus disaster drill in Houston at UT Health with all 6 schools and Houston Fire and forensics. So Debbie, what has been your biggest victory or your biggest challenge with y'all's program? Is Debbie still there? Ah, she's fixing her mic. Okay. There we go. So, Debbie, what was your biggest victory or biggest challenge with y'all's program, with your simulation? I think she may be having some technical problems. What are y'all's thoughts about interprofessional education opportunities like this? Or do y'all have questions for us, or maybe something that we didn't cover?
Yes, this is Dr. Miranda from Dallas. I think Dr. Timothy, who's the dental public health program director, is on this thing, but I think she's having audio issues.
Oh, okay.
And anyway, but I'm sure because she and I, and I think Tristan, who's also our program coordinator, is on this. And yeah, she says she's on. I can see her saying she's on. So I was hoping she would, I don't know if she's having audio issues, but one of the things regarding while she's working on her audio issues is, I wanted to mention is we want to have our dental students be involved in this, in the disaster day program, so they can also be exposed to it, because so far the College of Dentistry has not been involved. So part of us being here is, to learn how to be participants.
Okay.
So, Angela, can you hear me now?
Yes, I can.
Hi, so sorry, I switched my microphone. This is Debbie from Houston. I teach at the School of Nursing, at the Cizik School of Nursing in Houston for your UT Health. We have 6 schools in our system. They're all health science systems, and we don't have all the other disciplines y'all have. But I came from the Houston Fire Department as a clinical nurse specialist, and along with Dr. Elder Ramirez, we set up a big, this is probably our 5th or 6th year we've done it through the Houston Fire Department, and they of course have a huge fire training academy that we're able to use their equipment, their fire apparatus. They can actually turn on the fire. Of course, we do the moulaging, everything like that. So our biggest challenge, I think, like somebody said earlier, is the timing, because everybody's so busy on our planning team. We have a lot of physicians that are with us, and it's really just trying to get us all together involved in it. So right now, we've only used faculty and staff. We haven't actually used students, but we had a student from the School of Public Health last year that helped us as a student, and he joined us as a TA, and he actually gave us some great insight. So I like your idea about using students' input also.
Awesome, that's really cool. So Ellen was talking about this was a highlight of her pharmacy, for her daughter's pharmacy student experience. So that's great. I know that we have people that are still talking about Disaster Day months afterwards every year, because it's really an impactful experience, even if you're just a victim for the year. See, Debbie Tomshelli.
Angela, I'll jump in a little bit here.
Okay, why don't you, Martin?
So for the Doctor of Dentistry, thank you very much for your comments. Yes, it would be great if we get the College of Dentistry involved. That's something we've been looking to do for quite a while, because it just brings, and just like Angela said about the forensic dentistry, it's sometimes something you really possibly don't think about. So that would be a great thing to have. So we'd love to hear from you going forward about how we can make this happen. And this is a big scale type thing, but one thing we are considering, this became such a huge event, and people were still wanting more stuff, that we had to develop a disaster week to where there was symposiums and there was other trainings. There was a naloxone training. There was stop bleed training. But if you're thinking about starting something like this, just getting more than one discipline involved at a very small scale and have those people work together. And learn about the IP evaluation, the competencies, but at the same time, it is great for research. Learning, doing a good, a bona fide research study concerning an IPE event is one way to really start a good way of doing this, and then it can grow.
So I was looking at Danette's question about, is credit the same for all students, whether they are a patient or a provider? So the credit, I can speak to the School of Public Health. It doesn't matter if you're a provider, if you're volunteering as a patient. We don't give course credit, but we do give what we call scholar points, which you accumulate over your career as a student in public health, and then you can graduate with a special medallion of gold, silver, or bronze based on how many scholar points you acquire. And it works the same way with our undergrads as well. As for the professional schools, Martin, what is y'all's policy regarding credit for nursing students?
So like anything, it has to kind of go with the objectives. And so luckily we have objectives, community health type things, and disaster related objectives at our College of Nursing. So we actually give clinical hours for participation. Since the students, our most recent disaster day simulation was February 14th. We had students that only arrived on campus in January, so they were definitely just patients. Because they hadn't hardly learned anything else, right? So, but we do give the same amount of credit clinically. I do believe in medicine that they satisfy some requirement as well. And then looking at Jason's question, you talked about, the many levels of infrastructure, support, and logistics that kind of come together. And one of the great things when public health came in and we really started working with the people at Disaster City is teaching the students how items like the incident command system works, the National Incident Management System works. And it's much the way that, like Angela said, we have our org chart organized, but they realize that at a community up to a national level, that organization structure is the same. And so that's very helpful. And I think that they really learn a lot from learning that aspect of it.
So I do agree with Debbie and Martin about, the dental students in our College of Dentistry. It was actually brought up to me not too long ago from a dentist in the area that had heard about Disaster Day, and he was asking if we had plans on incorporating dentists into our program. And I think there would be a value added, and we definitely need to have an offline conversation about that to see how we can best coordinate participation across that extra discipline. On our evaluation process, we have about 50 faculty evaluators who are trained, and they have little survey type forms that they have to fill out, and they go and they are stationed in certain areas, and they observe the interactions that are going on between the different clinical providers and non-clinical providers. And it all is mapped back to those interprofessional competencies that we talked about earlier. And those are all turned in for analysis. And also all the participants are required to fill out a survey about their participation as well. And that data actually goes into the planning for the next year. We look at the data that we collect from the participants and see what the strengths and the weaknesses are, what worked and what didn't work, and we try to make small tweaks. There was also when we talk about debriefing, we always have that at the end of each session with the students to kind of talk about what needs to be changed for the next session. And they're able to kind of talk about feelings and things like that. Martin, I know someone asked about how the student leadership was selected.
Yes. So years ago, it was an interview system. We would interview for the incident commanders and the deputy incident commanders and even the committee chairs at that point. It's kind of morphed in different times through the different years about how it's decided, but usually we have faculty will look over applications, especially at the incident command level. So I'm looking at the chat. We've got about 9 minutes left. Angela, let's see what Debbie said. We thought about doing a morning and afternoon session, but thought it would be much work to reset up again. For us, we have to, because we can only have so many students. We have pretty much a brand new batch of students kind of come in. So we do have a halftime kind of a huddle to where one group's getting done at before noon, and the other group comes in about 1 o'clock, and we start it up again. So what recommendations do you have, Angela? And then we'll see about closing remarks.
So yeah, the splitting those two sessions is really important, because maybe a student can't take off a whole day from class, but they could take off a half day. So it enables us to reach more students. That hour break or so in between, where we have students leaving, students going, and arriving, it can get a little chaotic, but there's time to reset and to get ready for the next wave of students. And that's how we've been able to make it so large. So I guess with that, you're welcome. With that, we'll turn this back over to Chris.
Sure. Thanks so much, y'all. That was really, really exciting to hear a summary and to hear the robust discussion, and really addressing people's questions and hearing about their experiences as well. I am going to just share a couple of closing slides, but before I do that, I just wanted to see if there were any final questions about the ECHO format, about Disaster Day, about IPE at Texas A&M, and we might even be able to address with the remaining time, some of the remaining time, how COVID has impacted the planning for this particular event. So what might be of most interest to the group, if someone can chime in?
Yes, I would like just to thank you for this nice presentation. My question now, or let me say just suggestion. So we are talking about individual and institutional experience. So what about inter-institutional experience, like for example, collaboration between, let me say, Texas A&M UT system, so or Texas Tech, where we are from that? Do we have any future let me say, planning to do so or not?
Who wants to answer that?
I can jump in here a little bit on that. I know that Nimkid, the chief for Texas Department of Emergency Management, he's a vice chancellor for an A&M, so he's kind of working with us initially. But his goal is to have this type of disaster education training, especially at an IPE level, throughout the state. So we can kind of see that coming down the pike. And I know for me, I've been in conversations with some people from UT Austin, and then also Dr. Barnes, about trying to get our students together for a mutual exercise.
Thank you.
One thing that I see somebody posted in the comments about having to cancel some of their IPE for the summer because of COVID. I'll just briefly address to the group that the steering committee for Disaster Day in pretty quick order had to make some decisions about planning for Disaster Day 2021. because we start planning right after 2020 is over. And when COVID hit, we had some initial discussions where we decided that we would front load our planning efforts and move to a tabletop discussion by August, so that we basically divided up the planning, sort of carved out some pieces for the steering committee. And then what we're going to do, if we feel like we can actually go ahead with the event, is turn what we do over to the students to do the execution. So we really sort of separated planning and execution quite a bit. And that way, whatever planning we do for next year will be preserved should we have to cancel the event. So we just had to shift around the workload, the type of work that we give to the students, that type of thing, so that we could progress with our planning efforts without wasting a lot of time. So that was one thing that we did. All right, I'm going to go ahead and share our final slides here. Can you all see them? Our Healthcare Month additional events for our National Interprofessional Healthcare Month. We have several other webinars that are coming up, echoes are coming up. We have one on April 23rd, Scrap the Silos, a novel approach to interprofessional simulation in emergent conditions. And then we're going to be sending out an announcement by the end of the week about 3 additional webinars that are being scheduled or have been scheduled. One involves our College of Dentistry and their partnership with nutrition on April 30th, bridging the gap between dentistry and nutrition, interprofessional integration of nutrition education among dental hygiene students, and dietetic interns in the clinical settings. We will have on April 29th, the time hasn't been determined yet, an echo session about interprofessional rounding between medicine and pharmacy. And then we are also establishing a date for one of these sessions about LGBTQI health. So be on the lookout for those. Want to thank you all for coming. We appreciate your time. We know that these are busy times. We also know we have technical issues, so thank you for your patience as we all work from home with intermittent internet access and such. If you have any questions, please contact Martin about Disaster Day. Contact Dr. Beard about any echo questions and how the echo format and model are implemented. And if you have any questions about the Office of Interprofessional Education Research, you can contact me. And also we will be sending out a very brief, I promise it's brief, survey to get your feedback on this because we are entering into these echo sessions for the first time in our office, and we need your input to improve our efforts so we can continue to offer these free webinars so that people can share information across institution, across the state, and even beyond. So that's it for us. We thank everybody, and we hope that you have a terrific day.
Thank you, everybody.
Thank you.
Thank you.